At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions to Chronic Arthritic Pain on Wednesday, March 15th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, I have a special program for you. And, it's one of those days in Washington where we have to kind of wonder whether or not it's spring, summer, or we're going back into wintertime. Nevertheless, just make sure that you pay attention today because I'm going to give you a whole lot of useful information. But you know what? Hey, it was a great night Wednesday night at the Roselle Center in Fairfax. I want to thank all of you that took the time to come over. We had quite a full house, and it's always fun meeting people for the first time, and then many friends and folks that we've known for a lot of years. I enjoy giving you more and more information to make your life a little bit better and a little bit more hopeful, perhaps, than what it was before. And we talked about some really interesting and serious things when it came to brain function and dementia and fogginess, and the ability to focus or not be able to focus. And the tools that you got the other night were things that you could use to make a huge difference and clear some things up. There's nothing worse than getting to that place in life where you have a little bit of time and you want to enjoy it, but now you forget what you did yesterday. Well, it's not something that you have to be stuck with as long as you're willing to change and make some shifts in your lifestyle and, get treated the way you're supposed to. We talked a little bit about the impact of trauma when it comes to brain function. We talked about biochemistry and high levels of inflammation. We talked about those stress patterns, which jack up your cortisol level. And when we hear the word cortisol, we're talking about acid. Those are the deteriorating things that cause your body not to function well. That was all about Wednesday night. But you know what? Today's program is going to incorporate that inflammatory pathways, some of the things that we talked about the other night, but with a little different situation. Those using inflammation, inflammatory, what else does it cause other than what we talked about? Well, we're going to talk about degenerative joint disease, commonly known as arthritis. And it's a prelude. We're going to do that over the next couple of weeks. We're going to talk about different immunological responses. We're going to talk about what happens, why we get to the place that we get to. And then ultimately, we're going to invite you in to the Roselle Center coming up in March, and it will be Wednesday, I think it's going to be the 15th of the month, and same old time at 6 o'clock. Wednesday evening at the Roselle Center for Healing in Fairfax. And we're going to have a special treat for those of you who are out in Leesburg and Loudoun County area and so forth. We're actually going to go out there and do a second night on a Thursday night at Core Concepts Chiropractic by Roselle. And the clinic director out there is Dr. Leonard Poe, and we'll talk a little bit about that as we go through the next couple of weeks. But I want to give you as much data as you can. I want to set the stage for this thing. And the first thing you need to know is, what is an arthritic problem? Well, if you talk about what the word actually means and you kind of break it down into pieces, arthros, the first part of that term arthritis, means joint. That's all it means. And itis means inflammation. But here's the deal. It's only an arthritis if there's an inflammatory reaction that's going on. You can have joint space destruction that's old and chronic and kind of just sitting around and causing you impairment. But unless it's inflamed, irritated, swollen, it's not an itis. It's an arthrosis. Kind of weird, isn't it? So now you know how to differentiate the two. So when you go to your doctor and he says you got arthritis, and you look at him and say, do I have an inflammatory reaction, doctor? And then ask him the next question, what's causing it? And when they stumble all over themselves, see, because by the time we're done now, over the next couple, 2-3 weeks, and then we're going to, talk about the interplay on a natural therapeutic basis. And the most important thing is if you catch this thing before it totally destroys the joints, then guess what? You can resolve it. You get your life back, providing that you want to take the steps that will make a difference relative to this condition that's going on. But there's many different types of arthritic conditions, but we're going to talk about what they are. We're going to break them down for you. We're going to talk about the effect that it has on the body, this inflammatory pathway, and so you get a better understanding of it. I don't want anybody to just say, oh, I have arthritis. And if you ask them the question, who told you that, number one? Secondly, why do you think you have arthritis? Or why do they think, what test did they run? By the time we're done and leading into that Wednesday evening, which we're going to go through chemistries, we're going to show you visually what the situation is, and we're going to have that opportunity to put all the pieces together, and perhaps you'll do what's necessary to make a difference. So here's the beginning situation is, what is an arthritic problem? So we said it's a breakdown within the joint space. It's an inflammatory reaction. But what are the triggering mechanisms? So as we go through, you're going to learn that much of these joint space problems can be stimulated, they can be irritated, they can be triggered by, caused by viral patterns, other bacterium, and so forth. Now, in the world of COVID that we've gone through the last few years, what we're finding is that trauma and the vaccines and the boosters have aggravated inflammatory reactions throughout the entire body. And these viral patterns, particularly Epstein-Barr virus, cytomegalovirus, the COVID virus, have a propensity for all kinds of areas in the body, but one of them are joint spaces. So you have to make sure that, you understand the model, if you will, and that's the whole purpose, is to make sure that you get it, you understand, what's going on, what triggers them. And if we can get that squared away for you, you can take a very different approach and make things better. But, when we talk about arthritic conditions, we can talk about osteoarthritis. That means, they'll say, well, you have osteoarthritis. Well, great. That means that the bone, the joint is breaking down. But the question that you need to ask is why? What's going on? What caused it? What triggered it? Where's it coming from? You have rheumatoid arthritis. You have gouty arthritis. You have immunological reactions across the board that can cause joint space destruction. But it's the inflammatory reaction that we have to make sure that we understand and how it comes about. And we're going to talk about each one of those pieces, and we're going to tie those together leading into that night on the 15th. But I really want you to understand what you're dealing with. Now, a lot of people have to live with this inflammatory pathway problem if they don't do something about it. Inflammatory arthritis, all by itself, inflammatory arthritis is a condition that most people just put up with. They're given medications to deal with, and it's not okay. It just progressively gets worse. So we have to differentiate, and we will as time goes on. Inflammatory arthritis versus osteoarthritis, inflammatory arthritis versus autoimmune arthritis. But if we really went down through the literature, if you went into Hollinshead Dictionary of Medical Terminology, if you will, and you looked at the definition of arthritis, you'd see not only dozens, but in some cases 100 or so different types of arthritic conditions. Which one is yours? You were just told that you have arthritis. But we have things like called ankylosing spondylitis, which is an arthritic type of situation, and it causes the joints of your spine and throughout your body to fuse together, so pretty soon you can't bend at all. We have something called psoriatic arthritis, psoriasis, that can go to the spinal system. We have something called pseudo-gout. We have juvenile idiopathic arthritis. We have rheumatoid arthritis. And the list goes on. It's crazy, right? So what type is yours? In today's world, if you watch television, everything is being addressed from a biological point of view. They want to suppress your immunological responses, your immune system, dampening down that inflammatory reaction. Now, the problem with that is when they dampen that down, they dampen down your whole immunological responses to virtually everything. So let's pick this inflammation apart, right? Inflammatory conditions, arthritic conditions, the most common presentation is joint pain and stiffness. The joints are sometimes hot, not always, but they can be. They can feel slightly warm. They're swollen. They hurt to the touch. Inflammatory arthritic conditions, can affect other body tissues. And this is where we got into the other night. It can affect your brain. It can affect the lungs, the heart, the eyes, the skin, all the organ systems. And unfortunately, the damage that it occurs over a period of time can be significantly pathological. That means that there's damage to the tissue that sometimes, if it's looked at in our world, not so much, but if it's looked at from the traditional allopathic world, is irreversible. So when we have an arthritic condition, there's lots of things that we have to find out about. We got to find out what the immune system is doing. We have to find out what your white blood cells, these little guys called lymphocytes, are doing in the body, because they're the guys that will attack invaders that are coming in. They go after, and particularly like something called a monocyte. It's just a type of white blood cell. They go after viruses. And, when I go over blood work with patients, I show them very specific situations. I say, okay, let's look at your white blood cell count. And it comes out to whatever it is. When I was in school, 5,000 is where you should have been. Now they've dropped the parameters down early. It's not because that they're normal. It's because they're seeing more and more people with abnormal situations, so they're saying, it's normal. So then you're going to hear words like neutrophils. You're going to hear words like lymphocytes. You're going to hear words like eosinophils and basophils and monocytes and things like that. And it's the ratio of these things that give you some suspicion, even if they're within normal, supposedly laboratory brackets, markers, that are going to cause a problem. So the other day I was with a patient, and I told them, I said, come here, let me show you something. I think you got a viral path. What do you mean I have a virus? I think you got a virus. Come here. So we sat down and we looked at the white blood cell count. And the white blood cell count was really suspicious of a viral pattern. Why did I say that to this patient? Because that neutrophil, a type of white blood cell, was decreasing. The lymphocyte is a type of white blood cell that was increasing. They were reversing their positions, and something called a monocyte was becoming too high. Now, when you see that, it's a flag. It says there is a viral something something. It could be Epstein-Barr virus. It could be cytomegalovirus. It could be the coronavirus. It could be so many other different types of viral patterns that are causing that. Now, if you see the neutrophil level, a type of white blood cell, go up, you can start maybe we got a bacterial something going on. But look, here's the deal. You've got to take each situation in its own presentation. And if you don't do that, if you don't take it for what it is, so to speak, you're not going to be able to identify where and how and what you should do. And just remember something. Your body is a self-regulating, self-healing mechanism, providing it has the right situation available to it. That means your immune system has to work. Now, when you do inflammatory testing, you have to do things like a test called C-reactive protein. You have to do something called ESR, or erythrocyte sedimentation rate. That's how fast the inflammatory level is moving. So those are just two of several things that we would run to judge inflammation. Then you've all heard the interleukin pathways, right? We know interleukin 6 went crazy when we had all these viral loads relative to COVID. We know that interleukin 10 is a problem. So we look at TNF alpha, which is another immunological response. Again, I don't expect you guys to be biochemists. I just want you to know that you heard it. And if you have an interest, you can go and look it up for yourself and see what they're really all about. But there are many different types of inflammatory reactions, right? And so if you're experiencing the symptoms that suggest that you have an arthritic condition, and more so that it's an inflammatory reaction, you got to make sure that the tests are run correctly. Everything from an X-ray of the joint space, joint ultrasound, MRIs, CAT scans, maybe. But sometimes I think we dig too deeply, too hard to make sure that, we're covering all the bases. And then sometimes I think it's just running up the dollar bills, for the different imaging companies out there. But that's my opinion. That's just Dr. Tom telling you something that's going around in his head on a regular basis. But when we look at rheumatoid, when we look at psoriatic, when we look at juvenile, idiopathic arthritis, when we look at gout, when we look at ankylosing spondylitis, all these things are different types of conditions that affect the joint spaces. As we go through the next few weeks, we're going to talk more about inflammatory reactions. We're going to talk about how and what might be able to be done to reverse some of these things. And, when you're moving and doing and you're controlling inflammatory reaction, you can virtually turn most things around. We're coming up to the break, so listen, don't go away. We're going to be talking about more of these inflammatory conditions that affect your joint spaces, and more importantly, what you can do about it. You're listening to Dr. Tom Roselle Live. I'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM WMAL.
Welcome back, everybody. Dr. Tom Roselle here. Got a really interesting program for you today. We're talking about inflammatory joint problems. It's commonly called arthritis. And again, I want to say thank you for all those who took the time to come and visit us at the Roselle Center for Healing in Fairfax. It's always a pleasure. It's so much fun to meet all of you guys and to share information and to give you things that can make a difference in your life. And that's why I keep doing what I'm doing, because it's about you. It's not about anything else. So let's get back into what we're talking about. We're talking about joint space breakdown and inflammatory reactions that cause you to come up with a diagnosis called arthritis. As I said earlier, what type of arthritis? Which one is affecting you? Everything from osteoarthritis to rheumatoid arthritis to, psoriatic arthritis, gouty arthritis, the list goes on, and even juvenile rheumatoid arthritis. But the interesting thing about all this, there are many ways of modifying and reversing the condition before it causes you to be totally destroyed and hobbling around and joint space repairs and things of that nature. I've spent my career trying to answer the question, why is that? Why do people have these problems? Why do they lose calcium from the bones? Why do they have these destructive conditions, these fusing conditions that take place? And fortunately, we've been able to look at it a little differently, other than just throwing a drug at it. And if somebody becomes proactive, they're willing to do what it takes to make a difference in their own lives. So many of these wear and tear conditions that were triggered by sometimes viral patterns, by bacterial problems, can be shifted and changed. You look up in the literature and it said, well, as you get older, you're going to have this. Well, I've seen 80-year-old people with beautiful spines, and they have no problems. I've seen 80-year-olds with bad spines, and they don't seem to have any problems. Now, what's the difference? Well, the difference is immunological responses and how we treat our bodies. And it has to do with dietary patterns, exposures to certain things, the unwillingness to do what we need to do to, if you will, exercise a little bit and get things to move properly and the like. But we're in a society of catch as catch can. That means that we don't take the time really to pay attention to what our body needs. And that's the problem. We have to take the time, because if we have a good machine to carry around lifetime called our body, then everything else is much easier. But if we don't, and if it breaks down and it hurts, it's inflamed, not only do we suffer the inability of good function, locomotion, and strength, but we become more susceptible, if you will, to other types of situations, conditions. We talked a little bit about some blood testing that needs to be done. You have to do a lot of different things, but it has to be specific. But here's the most important part. It has to be interpreted properly. And unfortunately, laboratory parameters are such that it shows the highs and lows, but as doctors, sometimes they forget to look at the person in front of them. And even though you have a normal something, it may not be normal for that person in front of us. Even though that the parameter says, well, you're close, you're pretty close, we'll watch it. You're going to watch what? You better take action early on so you can make a difference as the problem begins to unfold, because if you don't, you got a problem. You know, when you're looking at something called ankylosing spondylitis, there's a lot of information in the literature that if you look at it says that it may be triggered by some type of microorganism, that it could be a bacterium in the intestinal tract that's gotten out of control. And there's predispositions. There's a gene called HLA-B27. You know what? The presence of which can help confirm the diagnosis if the spine is fusing up and the like, but it's not necessarily a one situation catch-all. We're going to get more into this. We're going to talk a little bit about what calcium pyrophosphate does in the system. But remember, all this is leading to an in-house presentation on the 15th at the Roselle Center for Healing. If you go to rosellecare.com, you can register right now, save your seat, because we had a full house the other night and we had to tell about 25, 30 people that we didn't have room for them. But we're coming up to a break, and I wanted to make sure that I give you all the information. We'll talk a little bit about uric acid and the applications, but we're going to really unfold this inflammatory reaction. You're listening to Dr. Tom Roselle Live. Don't go away. I have a whole lot more for you.
This is Dr. Tom Roselle Live on WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Talking about arthritis. We're talking about inflammatory reactions that affect your body's locomotion, right? The inability to move easily, to bend. You know, some of us are out of shape and we don't bend so well. Some of us got a little bit too much around the middle and we don't bend so well. But having said that, there's other reasons for that. And, you know, if you look at your hands, you put them out in front of you and you see these nodes, these little bumps and lumps at the distal end of your fingers. You know, they look like they're building up either right on top or on both sides. Those are called Heberden nodes. And they are the prelude or the director that tells you, guess what? You may have a rheumatoid arthritic condition, particularly as we get older. And there's different types of rheumatoid arthritic presentations, but that's one of them. They're called Heberden nodes. But we're going to get into that as time goes on, and we're going to tell you why that happens. But for today, we're going to get into the breakdown of certain types of situations. I told you before the break that there's this substance called calcium pyrophosphate, and there's a longer term as calcium pyrophosphate dehydrate, and that shows up with gout or pseudo gout as well. And these are depositions or things that get into the joint spaces, and they form these arthritic problems. And there's certain type of crystals, if you will, that cause tremendous amount of damage. They result from something called uric acid, which is typically a gouty condition, right? Gout will affect the big toe of the foot first, then it affects the knees, then it affects wrists and so forth. Why does it do that? Well, in my world, in the natural world, and we look at energetic platforms, the acupuncture channel, now we're going to Eastern medicine, that's called liver or affects the liver and the gallbladder, starts on the big toe. So it becomes, the term that we'll use is called stagnation. It's stagnant. The energy is not moving. So the toe gets swollen. It gets hot. It gets inflamed. It's because that liver is not able to handle the buildup of pyridine, and it causes this inflammatory toxic reaction. And it hurts. These crystals can cut That's where the bruising comes from. That's where you see knee joints get swollen, but they look like you've been on a blood thinner for 10 years, and everything just begins to look pretty ugly. Gout results from an excess of uric acid, but here's the deal. It can crystallize in the joint space, including the spine. So it's not just a situation where it's going to affect the toe or the knee, but it can go to the spinal system as well. And so when you have this buildup, you have a risk of all kinds of things, even kidney stones, which is one of the things that can come about because of a gouty type of arthritis. But the white blood cells now go into overwork, and they provoke inflammation. Now, what I want you to know as we go through this, just don't say, oh my God, oh my God, oh my God. You can turn this around. You can make a difference, and that's what we're going to talk about as we go through. And particularly on the 15th, we're really going to get into the intricacies of this, and we're going to show you how this can be reversed. But guess what? We need you as a partner. You have to be able to take the data and be willing to apply it so you can begin to reverse things. The only reason most things don't work is people don't walk the path. They don't do what they need to get done. Now, if you have an inflammatory reaction in gout or rheumatoid arthritis or pseudoarthritis or spondylosis or spondylolisthesis, there's an inflammatory reaction that takes place first, right? And that causes the joint space to break down. But if you're not willing to change something, you're going to get more of the same. You do the same thing over and over and over again, you get more of what's taking place with you. So when we look at what's going on, we look at the medications that you're taking, we look at your lifestyle, we look at other conditions, we test for bacterium that most docs don't, we look at viral patterns, but you have to be able to really unfold the why is that. And once you understand that, once you really get it, and if you're willing to make some changes and some shifts, guess what? Life gets better very rapidly, very quickly. So there's so many people that are on NSAIDs, non-steroidal anti-inflammatory drugs, and things like ibuprofen and naproxen. Those are typical. Aspirin's an anti-inflammatory, and it's an NSAID. Now, what's the problem? Well, you start hurting a little bit, and you start shoveling all these NSAIDs in your body, and what takes place, what happens, it competes for the things that heal the joint spaces. It competes for the sulfate ion, and that's what you need to repair cartilage. So now you've got these receptors, these lock and key mechanisms in all tissues, but we're talking about joints, that are being taken over by the NSAID, so the sulfate ion can't get in, and now you get, even though that you've knocked down the inflammation, you perpetuate the degeneration. It continues to get worse. You know, same thing with steroid medications, things like prednisone, methotrexate, which is a very common drug for advanced arthritic conditions. They cause further destruction for a period of time, you know, whether it's methotrexate or it's a sulfazine or a minocycline or something of that nature. They help you feel better for a short period of time simply because of the fact that they knock out the inflammatory reaction or at least slow it down. But the problem is these steroids, like prednisone, they're called corticosteroids, they cause the body to lose their immunological responses, and so now you have other conditions that begin to show their ugliness and add to the problem. So to try to spare people from surgery, try to get them to, to do well, the medical approach is to use biologics to dumb down the immune response. But unfortunately, by doing that, every other pathway is open for insult. And we're going to get into that. We're going to talk about that very specifically. It's important. Now, surgery may be indicated for specific joints and damage, but when it comes to surgery, you always want to do minor things first before you go in and have a total knee replacement or total hip. And there's guys out there in this country that do things very differently. And trust me, I know this pathway. I've explored it intimately. And if you ask me privately, I'll tell you what the pathway looks like. But understand that you can, if it's diagnosed properly, if it's an inflammatory arthritis, even though that it feels like it says, oh my God, what do I do now? I'm not moving. You can begin to reverse things, providing again that you're willing to follow a path that has been proven. Medicine in this country is extraordinary when it comes to crisis intervention. My opinion. There's none better. If I'm bleeding in the streets and I've been hit by a car, I don't want me. I want somebody that can put me together. But when it comes to functional day-to-day considerations, your body is the primary physician. If it's supported properly, it is designed to reverse virtually anything, but you have to be willing to turn things around. There's a drug that we all learned about in COVID. It's called hydroxychloroquine. It's been around for years. It's used in arthritic conditions as well. Hydroxychloroquine is an anti-inflammatory. It's also something that drags other things into tissue. So you drop the inflammation. That means you're taking the lock off the door. You're opening up that lock and key, and now something else can be brought in to begin to heal the process. It's one of the lesser of the evils that are out there if you have to do something for an anti-inflammatory drug. Now, once you understand that the body can be reversed, there's so much that you can do to make a difference. But you have to understand that inflammation kills. Inflammatory reactions are acidic. They cause destruction when they're there over a period of time. The other night, Wednesday night, when we talked about brain function, I basically drew the conclusion for everybody that if you have inflammation, think about it as acid. If you have acid, you're going to get destruction of all types of tissue. We're talking about joint spaces. The other night we were talking about neurological breaks down. Now, that can be reversed. I told everybody you can make a difference as long as you understand what the pathways, even with things like Alzheimer's, when we know we have these tau proteins and so forth, that and amyloid proteins that cause the destruction and breakdown of the covering around the brain and so forth. So here's the same situation, but now we're applying it differently. We're applying it to structure and joint spaces and the like. We want to maintain a healthy lifestyle, but are we willing to do what it takes to reverse things? Are we willing to do what it takes to make a difference moving forward? I don't know about you, but I think you should. I think you need to make that choice and claim your birthright. Be able to do what you want to do on an ongoing basis. Surgery is the last resort. You know, what we found out during COVID, and you've heard me say this several times, is that the vaccines and the boosters and trauma, by the way, and kind of injury, activate viral patterns in the body. So if you have these viruses, if you will, these Epstein-Barr viruses, cytomegaloviruses, even herpetic viruses, they all have a response not only in soft tissue, but they also have a response in joint spaces, in cartilage, and so forth. And once they're activated, they can cause destruction. So we're seeing a lot of people now coming in, and they're in worse shape than they were quite a while ago. And just remember something. Every one of you at this point have been exposed to the viral pattern called COVID. And I would stake my career on it that at least 98% of you are going to test positive for an immunological response to that virus. Because that's how your body defends itself. And it's almost impossible unless you locked yourself in the house and you never went out again, that you don't have some exposure. But that's a good thing, because now, if under the right conditions and making sure that your nutrition is solid, you have a good response immunologically. But the problem is that when we're adding sugars and sodas and coffee and fast foods and fried foods and alcohol and gluten and additives and preservatives to our dietary patterns, those things by themselves cause high inflammatory reactions and not only setting the stage for microorganisms, viral patterns and so forth, but set the stage for inflammation that can destroy tissue, particularly in this condition. We're talking about joints, right? So if you've tried everything, you've been on every drug known to man, and you really wanted to turn this silliness around, join me on the 15th at the Roselle Center for Healing in Fairfax and the 16th in Loudoun County at Core Concepts Chiropractic. And so those of you in Leesburg, you don't have to call all the way come into Fairfax, and you're out in the Loudoun County area, you're in the Ashburn area, we're going to be there. That's going to be a limited space, so you have to make sure that you register, and we'll give you an opportunity to do that. Go online at rosellecare.com and register. Remember I said that we've had full houses and we've had to turn people away, and I don't want to turn you away. Now listen, if we double the number of people that want to come in, I'll get a bigger venue. I promise you that we'll do that. But in the meantime, I want to give you the tools. My goal this year is to give you as much data, as much information as I possibly can give you so you can change your life, so you can be assured that you have strength. You can be assured, that your body is able to handle anything that is thrown at you. We're going to talk about dietary patterns that cause inflammatory reactions. We're going to talk about dietary patterns that will reverse inflammatory reactions. We're going to talk about modicums of exercise that will help you, but also certain types of exercises that are destructive and that'll make a difference. The other day I was talking to a patient, and I saw that this person who was well into their 80s had the kind of body I wish I had when I was in my early 50s. It was like super cool. This person, was working out on a regular basis, doing things from yoga to martial arts to lifting weights to walking, but in a balanced, modified way. But their dietary patterns had changed over a long period of time as well, to give them the support system, to give them enough protein, to give them the things, the fuel, if you will, they need to be able to sustain that. See, at any age, your body should be able to thrive. And that's what we want to do with this. We don't want you to suffer with arthritic degeneration. We don't want you to suffer with the slings and arrows of inflammatory reactions. Inflammation, my opinion, and the literature begins to bear it out, is the triggering mechanism for virtually every health condition out there. Unless you got hit by a car, and then the sequela of that is the inflammation that trauma causes. So the goal is this: give you the data, give you opportunity, give you tools that you can do it, give you an opportunity to get a hold of me. And if you want to ask me something offline, simply go to rosellecare.com or drtomroselle.com. Either one, message will get to me. I promise you I will answer it. I will never set it aside. I will give you all the information that I know that is relative to your question. And if I don't know it, I'll tell you, listen, we'll find out together and we'll make a difference accordingly. We're coming up to a break. I could go on, but remember, over the next couple of weeks, we're going to get into this in depth. We're going to talk about arthritic degeneration, and we're going to have you and invite you in at the Roselle Center for Healing in Fairfax on the 15th of next month. This is an important process to me, and I want you to understand that. Don't go away. I've got a whole lot more that I want to tell you as we wrap up the program. You're listening to Dr. Tom Roselle. I'll be right back.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live, as you do every Sunday at high noon on the Eastern Seaboard. Thank you, all of you that listen from different parts of the country. Some of you out in the West, the time changes. And actually, I was really surprised the other day. The couple people reached out to me from Canada. I didn't realize that they could pick up the program out there, but they somehow found it and were able to do that. Trying to make a difference in your lives, trying to help you make decisions from a base of knowledge and information and not from scare tactics. I want you to know that your body has the capacity to reverse itself and to change virtually anything that's going on, providing that you take the right steps to make that happen. And that's what we're doing. We're stepping you through the weeds. And whether it's inflammatory processes affect the brain, or as we're talking about today and will for next few weeks, inflammatory processes that affect joint spaces, and they affect your spine, and there's a plethora, host of all kinds of things that make that happen. But we're going to give you things to fix it. If you did nothing more today than start drinking water, And I mean fresh water, something that's been filtered properly. So you have the halides out. What are halides? Fluorines and chlorides. They cause inflammatory reactions in all kinds of tissues and joint spaces in the body. And you got out and just went for a walk every day. Just a real gentle walk. Go out and come back a little bit. Put a headset on. Best when you have your headset on, listen to our old podcasts, and I'll give you more information as you're walking through. And then give yourself a step-by-step process. Then measure it. Weight is kind of a nebulous situation, but get a tape measure, put it around your chest, get a tape measure, put it around your waist, get a tape measure, and, measure your legs and so forth. And you'll be surprised sometimes that the weight won't budge as much as you think it will, but it's not about weight. It's the type of tissue that you're putting in there. And what I mean by that, instead of fat, now you have muscle. So that means that the size, the measurements will become less over a period of time. And your energetics will become better. Your thought processes will become better. Your motion will become easier. Now don't go out and try to make up for 45 years of doing nothing all in one afternoon, because I promise you're going to hurt. You're going to cause inflammation by doing that. Just walk. Just stretch. Just use things you go by a corner in your house and put your one hand on one side of it, one hand on the other, and kind of bend and turn and twist and find things that you can do. So we're going to give you a ton of data, exercise and dietary patterns and nutritional programs to follow. That's why we're here. That's why we continue. That's why the Roselle Center for Healing is in Fairfax. That's why Core Concepts Chiropractic is in Ashburn. I understand that we're dedicated to you becoming what you want and who you think you should be. But you got to have the tools, and that's what this program does. It gives you the tools. And our men and women in service, you guys are great. You're amazing. Without you, I wouldn't be able to sit here on this microphone and put the information out that I know that you all deserve. And please reach out to me at any time. Go to rosellecare.com or simply drtomroselle.com, TomRoselle.com. Send me a note. I promise I will get back to you. I will give you all the data that you need to have. I will be more than happy to tell you, I'm not sure, but there's some people out that may know that answer. Let me check with them, and I'll put it together, and we'll get back to you. And if it's by email, I always do. If it's a program, I promise you that we will discuss it. And you can always call me here at 888-630-9625, and make sure you do that. Coming up to that break, we got to come up to the end of the program. I hate that. I could sit here and talk to you forever and talk about medical freedom. We can talk about choices. We can talk about how you make those choices. But guess what? We're going to do that over a period of time. You're listening to Dr. Tom Roselle Live. Remember, I continue to do this program for only one reason. You deserve it, and I love you. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Natural Solutions to Chronic Arthritic Pain on Wednesday, March 15th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.